What role does TB prevention play in global health security? Tuberculosis prevention is a vital part of keeping the world safe from infectious diseases. Despite being one of the oldest diseases known to humanity, TB still causes over 1 million deaths each year. Preventing TB helps protect individuals and entire communities from this serious illness. When we focus on prevention, we reduce the chance of new infections spreading, which keeps health systems from becoming overwhelmed. This is especially important in countries with limited healthcare resources. One of the key ways TB prevention supports global health security is by lowering the number of new cases and deaths. Vaccination with the Bacillus calmette-guerin vaccine can help protect children from severe forms of TB. Screening programs identify those who are infected early, especially among high-risk groups like people living with HIV. Preventive treatments, such as taking medication to stop latent TB from becoming active, are also crucial. For example, giving preventive therapy to people with HIV can cut TB deaths by up to 80%. These efforts help keep disease levels low and prevent outbreaks from spiraling out of control. Another critical aspect is controlling drug-resistant TB. When TB is not properly treated, it can develop resistance to standard medicines. Multi-drug-resistant and extensively drug-resistant TB are harder and more expensive to treat, and they pose a serious threat to health security worldwide. Prevention strategies like infection control measures and early detection are essential to stop resistant strains from spreading. Studies show that most drug-resistant TB cases come from person-to-person transmission, which highlights how prevention is key to stopping resistance from growing. Protecting vulnerable populations is also a major goal of TB prevention. Marginalized groups such as people living with HIV, prisoners, displaced persons, and those in low-income areas are more likely to contract TB. Preventing TB in these groups reduces health inequalities and strengthens community resilience. It also eases the burden on healthcare systems, allowing them to better handle other health emergencies. Economically, TB has a big impact because it affects working-age adults, leading to lost productivity and high healthcare costs. Investing in prevention saves money in the long run by reducing these costs and helping people stay healthy and able to work. This economic stability supports broader social stability and development, which are important for global security. International cooperation and funding are vital to sustain TB prevention efforts. Countries with high TB burdens relying on global support to maintain programs like vaccination, screening, and treatment. When funding decreases, progress can reverse, leading to more cases and deaths. Global strategies led by organizations like the World Health Organization and the Centers for Disease Control and Prevention help coordinate efforts and set targets to eliminate TB. In summary, TB prevention plays a crucial role in global health security by reducing illness and death, controlling drug resistance, protecting vulnerable groups, supporting economic stability, and fostering international collaboration. Without strong prevention measures, TB remains a persistent threat to health systems and populations worldwide. It is essential that we continue to prioritize and invest in these efforts to keep the world safer and healthier for everyone. Always remember to consult healthcare professionals for personalized medical advice and stay informed through trusted health sources.